Hi, this is Dr. Matt Joosse at Joosse Family Orthodontics in Williamsburg, Virginia. We do braces, we do Invisalign, we change lives with beautiful smiles. Here is one that I want to show you. I love this case, and I've been making a series of videos about what it's like as an orthodontist to work with some of my great colleagues in dentistry, work with general dentists, work with gum specialists, periodontists, and I'll do some where we work with an oral surgeon as well. So I want to show you this case that demonstrates what is possible working with some of these professionals. So let me show you. This is Lucy, and Lucy came to us because she wanted a nicer smile. So this is how she started. This is her teeth when we started, and you can see that these two teeth right here kind of stick out, they flare out. She wanted to close the gap between her two front teeth. And one of the things that I felt really strongly about fixing was making sure that we had less overlap of her upper front teeth with her lower front teeth. This is something that we call a deep bite, and deep bites can lead to excessive wear down of upper and lower front teeth over time. So we wanted to make sure that we fixed that as well. There were some bite issues in the back as well that we won't highlight in this video. So this is where we finished Lucy, and I thought this was a really, really great orthodontic finish. This looks really, really good. The teeth are very well aligned. I think it is an absolutely beautiful smile for a beautiful young lady. But I want to show you what's possible when we work with other dental professionals. And so let me go back to here. And if I'm being critical about the finish, one of the things that I don't like is when I look at these front two teeth, the gums are kind of flat across, and the gums don't come up higher than the adjacent teeth. And so sometimes we work with gum specialists or periodontists, and we can alter the shape of the gums a little bit. So I did a little mock-up, and I want you to see what that looks like, because I think that just a tiny amount of gum removal can make a really nice change. If we did something like that, and I know the color is a little bit off, but you get the idea. It just restores the contour of the gums so that there's a little bit of curvature on these front teeth, and so that the gums of these front teeth are a little bit higher, if you will, than the adjacent teeth. So that's one improvement that can be done if we work with a periodontist or a gum specialist. So let's go back to our finish. Another critique that I might have, and I'm very careful to critique this because my teeth are the same, but everybody has different shapes of teeth, and as dental professionals, we classify these into groups sometimes, and we would call Lucy's teeth, and you would call my teeth barrel-shaped. So barrel-shaped teeth are widest here, kind of in the middle of the tooth, and then as you come down to what we call the incisal edge or the biting surface, the teeth actually narrow a little bit. And what happens when teeth narrow towards the incisal edge is that some people perceive there as being space between the teeth. So like in this area right here, you might perceive that there's space between the teeth, but they're not. They touch up here. It's just that the way that they're shaped, there is a little bit of space down here. Same thing with these areas between these two teeth. Some people will say, hey doc, I need you to close this space. But the reality is these teeth touch. It's just because they're more narrow at the biting surfaces than they are in the middle of the teeth that it has this appearance. Again, my teeth are the exact same way. So I did a little mock-up again to show you what it would look like if, in addition to the gum procedure, what we call a gingivectomy, what would happen if her general dentist bonded a little bit to the teeth. So it might look something like this, and I know it might look a little funny to have the off-color white on there, but hopefully you get the idea about reshaping the teeth a little bit. Now, bonding to teeth isn't something that I will always recommend. So again, in Lucy's case, we did not do any of this. And to be really honest with you, I don't think I would do the bonding if it was my own child. It doesn't make it right or wrong, it's just my own personal preference. My preference is that I don't want the bonding to be there on my own child because it might chip over time, or it might discolor over time. It might need to be replaced over time. It might need to be replaced several times over their lifetime. And so I personally like setting people up for the less dentistry possible over their lifetime. But I do also think that it's instructive that people understand that, hey, we can change the shape of teeth by adding to them, and sometimes it's a much more aesthetic result if that's what you're going for. Now, once again, I love this girl's smile. I think this is a wonderful result. I think she's a beautiful young lady. I just wanted to educate people about what's possible. And so I hope that's an interesting video for you. There are other times where procedures with other dental specialists can really augment the result that we get orthodontically. But again, this is a great orthodontic result. I'm super happy with it. We are probably not going to pursue any of these things in Lucy's case. And I just think she's a really beautiful young lady with an awesome smile. So congratulations, Lucy, on your new smile. Here we are celebrating it at the end of her treatment after we took her braces off. And anyway, once again, I just think this fits her really, really well. Take care.